Welcome
Good
to
morning,
today's
everyone.
session. Welcome to today's session on postpartum care by Apollo Cradle and Children's Hospital, Motinagar. To speak on the topic, we would like to welcome Dr. Seema Thareja, who's an in-house consultant in obstetrics and gynecology. She has done a MBBS, MD, obstetric and gynecology. We welcome you, doctor. You can now take over the session, ma'am. Thank you.
Hello, good morning, everybody. Welcome to the chat today. I'm Dr. Seema Thareja at Apollo Cradle Hospital, Motinagar, Delhi. So today my topic of discussion is postpartum care of women. Now, as you all know, having a baby or a childbirth is once in lifetime experience in every woman's life. So, as antenatal care is important, the process of delivery is important. Now, the care of the women after delivery is what we mean by postpartum or a postpartum period. So, postpartum care of a lady or a woman is equally important as antenatal, and childbirth or labor is important. Now, what is the time duration of postpartum care? As you all know, postpartum means post delivery. Now this period starts immediately after delivery and extends up to 4 to 6 weeks post delivery. So the care given to the mother during this duration is technically known as postpartum care. Now, this is usually divided into the mother goes through the various changes post delivery, physical changes, emotional changes, as well as taking care of the baby. So, all these factors are considered in postnatal care. Now, when a lady has an institutional delivery, usually the lady is in the hospital in the first 3 to 4 days. So, according to the WHO guidelines, postpartum care is divided into few this thing that follow up should be within the first 24 hours, and the next follow up should be within the next 48 to 72 hours, and then the third follow up should be between 7 to 14 days, and the last follow up is a month or 6 weeks post delivery. Now, as I said, in a hospital delivery, usually the first two visits, like the 24 hours and the 72 hours, is patient is already there in the hospital. So the healthcare workers or the doctor is taking care of that. And in a follow up, we always call a patient within a week or 10 days. So the next follow up is also taken care of. Now, in the first 24 hours, as soon as the patient or the woman has delivered, what are the things which one should take care of? Now, regarding the medical aspect, we look after that the patient is vitally stable, that is a pulse, blood pressure, because a normal delivery, as you all know, or any delivery has a basic level of blood loss. So you check for anemia, the vitals, the uterus is well contracted, patient doesn't have excessive bleeding. So all these factors are taken immediate post delivery care. And in the 24 hours also, we look for excessive signs of bleeding or blood loss, or if patient has anemia, we take care of that also. And if a patient has had a normal delivery, then we do check up the episiotomy site regarding any uh, blood clot formation in the stitch line or undue unnecessary pain in the stitch line, immediate severe unbearable pain in the stitch line. So all these things have to be looked into the first 24 hours. If the patient has associated medical complaints, like patient has been a hypertensive or a diabetic during pregnancy, then the monitoring of blood pressure, monitoring of blood sugar, and accordingly the management has to be given. Especially in high blood pressure patients, we need to be looking for that the patient doesn't throw any fits or doesn't have any undue impending signs of fits or severe headache or any other major issues. So, medical management regarding the blood pressure and the blood sugar has to be strictly monitored and controlled, which is important in the first 24 hours. After that, and also in the first 24 hours, we make sure that the patient has adequate rest, is given plenty of liquids, is encouraged to pass urine. So all ambulate patient has to be ambulatory also if the patient has had a normal. This I'm talking about a patient who's delivered vaginally or has had a normal delivery. And also we initiate lactation, or at least we the baby is moved in with the mother, skin to skin contact is given, a lactation counselor visits the patient and uh, tells the patient regarding how to initiate lactation and how to take care of the breast and the nipples and how to initiate the lactation. So first 24 hours usually the mother is counseled regarding all this. And the next 2 to 3 days, like after 48 to 72 hours, usually uh, in those 3 days, we make sure that the patient is switched on, patient is ambulatory, has learned how to feed the baby, the lactation process is initiated, and the milk flow is adequate. Patient is passing urine and motion without any problems and without any complaint, as well as the stitch line. There is no swelling or there is no untoward stitch line infection before the patient is sent home. So, usually in a normal delivery, well, according to the WHO, minimum 24 hours stay is required in the hospital and then the patient can be discharged. But averagely, in 2 to 3 days, we can discharge a patient who has had normal delivery. Now, regarding patients who've had a cesarean, in first 24 hours, well, the patient is not made ambulatory or is not allowed to sit up because it is done under spinal anesthesia. So basic care is almost the same, except for the episiotomy stitch line, and there is an abdominal stitch line. But the signs and symptoms of excessive bleeding, pulse, vitals, blood pressure, if the patient is diabetic, sugar, all that remains the same. So basic care does remain the same. It is just that the patient is not allowed to sit up and patient is not ambulatory in the first 24 hours. After the 24 hours, in a cesarean patient also, we encourage the patient to sit up and then start moving around. There's no role of complete bed rest even after surgery. After 24 to 48 hours, all the patients are encouraged to move around and walk around so that they don't develop other complications which do develop if the patient is absolutely bedridden or prolonged resting is there. Other thing in cesarean patients, one has to look relating any spinal anesthesia problems like headache. Commonly, that's a common complaint the patient has post-operatively. So the patient is encouraged to drink plenty of fluids. So in general, also in postpartum, we always encourage the patient to have plenty of liquids so that the bowel and the urine movement or patient is able to pass urine comfortably. Since tendency to have urinary infection, urinary tract infection is also common in postpartum period, because even the urinary tract does have bear a little bit of trauma during natural childbirth as well as in cesarean. So it is important that the urine flow is adequate. For that, the input or the liquid intake of the patient should be good, and the patient should be told or encouraged to frequently go and pass urine. And normally the diet is usually diet also is to be taken care of in cesareans. Of course, first day we are usually we 6 to 8 hours later we put the patient on a liquid, we start liquids, and gradually as the patient accepts the liquid, we start the patient on semi-solid and then on a regular normal diet. Now all this is taken care of within the first 48 to 72 hours. So whether it's a normal delivery or it's a cesarean, a patient is ready to go home within 72 hours. Now this is regarding the hospital care. In that, of course, neonatology care or the baby care the lady is counseled by a neonatologist. Regarding a lactation, we do have lactation counselors which educate the patient regarding lactation and how to take care of the breast and to watch for signs of breast engorgement, collection of milk, how to feed the baby. So, all these tips are given to the women before she is discharged. So, as I said, this is the physical aspect of taking care of the women. Along with the physical care, it is important to take care of the emotional well-being of the mother. Now, this again is a very wide, vast topic because even mental health in postpartum in ladies, it is quite common to have postpartum depression or postpartum low feeling. Now, this is a topic in itself, but I'll just touch it in brief. Since childbirth itself is quite overwhelming, it's quite exhausting, it is traumatic to some women. So mentally also the women is drained, and post delivery she's she thinks she has so many responsibilities of looking after the baby, looking after her health. All that can be overwhelming and quite demanding on the mental health of the women. So that's where actually the support of course, the healthcare workers and the family. Family plays a major role since the once after 48 to 72 hours, the woman is discharged and she's sent home. So usually, this feeling of what we call it as baby blues, the patient feels very low, fatigued, lack of sleep, too many changes in her body as well as the surrounding issues of taking care of the baby, lack of sleep. So the women or the mother may feel very fatigued, listless, low mood, loss of appetite. All these are mild symptoms of depression, and this may set in usually within the first week of delivery, but they are quite mild. And with the support system of the family, maybe the partner or your relatives, be mother or mother in laws or elderlies in the family, usually in India, there is a support system. So women are able to tide this period of mild depression without any medical treatment or any medical drugs required. This is a temporary phase, usually goes away as the women or the mother feels confident to look after the baby, sees her child, and the child is gaining weight nicely, is healthy. So that gives confidence to the mother that she can look after the baby, she's competent enough. So that feeling of low esteem and feeling tired, all that then gets overridden by joy of taking care of the baby. So these minor depression or baby blues goes away within 2 weeks. But in certain cases, yes, some women are prone to severe depression, what we call it as postpartum depression. And if it is not corrected by taking care by the family members or by counseling or mild by healthcare, then we need to take a psychiatric help or put the patient on some antidepressant drugs for a short time. As I said, it's a self limiting thing. Usually it goes off, it doesn't really continue for a very long time. So, postpartum depression is generally a limited depression. It goes away with time or with little bit of treatment. This is regarding the mental care and the mental well-being of the mother. Now, there are certain danger signs which the lady should report back to the hospital in case these signs are present once she is discharged. So, mainly it is if the patient has very excessive bleeding at home, then she should report to the hospital. or there is very foul smelling vaginal discharge within a week or so after delivery, or develops very high grade fever along with the discharge, then also she should report back to the hospital. If they have urinary complaint, as I said, urinary tract infection is also very common post delivery. If there is any difficulty in passing urine, severe burning, pain, and fever, so suspicion of UTI, again, the patient should report back to the hospital before, 10 days of follow up or something. And another common complaint is constipation post pregnancy. Now, that may lead to hemorrhoids and painful pain while passing stool and all. So, these complaints also, if they are aggravated, the patient can report back to the hospital, and then accordingly, the patient is managed or treated. Or if the patient has been a high blood pressure patient throws a fit, then again they have to report to the hospital. So these are the few danger signs or few alarming signs in which the patient should be reporting back. And there are some general complaints. The patient may have pain in the stitch line, whether it is cesarean, episiotomy. Now, some amount of pain, some amount of discomfort is normal. But if undue pain and unbearable pain or any discharge or bleeding through your wound site, then you can report back to the hospital. So now this period of 2 weeks post delivery, some patients are absolutely okay in 2 weeks and they are, almost normal and they are back to their routine. And some patients take time. So each this the recovery is little individualized. So some patients recover very fast, some take some time. So the mother should allow herself to heal that, and the family should understand that every individual takes some time to adapt to these changes, the body changes as well as mental changes, and taking care of the baby. So we should give time to the mother to bond with her child, to enjoy this new phase of life. And if she is very low or she is upset with too many changes, then the family should help in and support her so that this changes. It's easy to for the mother to accept these changes. And as I said, diet is another aspect of postpartum care. Usually, the diet is the bottom line of the diet is the mother should have healthy, nutritious diet. Calorie wise, a feeding mother approximately needs 300 calories more than a normal non pregnant or a non feeding lady. So the food should be healthy, wholesome. As I said, plenty of fruits, vegetables, water intake should be good so that there is no urinary tract infection, there is no constipation, and the food should be easily digestible. Since the mother is not doing her normal routine and too many changes around her or due to the postpartum period. So sometimes the digestion also creates problems. Some patients are able to eat and digest everything even if they are not that active. And some patients' digestive system doesn't accept too heavy food or because they are not that active during the postpartum period. Usually they are resting. So we shouldn't force the lady anything, or we shouldn't have too many restrictions regarding the food that you can't eat this, you have to eat this. This is the quantity you should eat. These foodstuffs are not good. So there's nothing like good food or bad food. As I said, your diet by and large should be as normal as what you were eating before or what you are used to. Now, this varies a lot between each culture, states, customs. So, every household has their own method of feeding the postpartum lady. So, but then you should give consideration to the mother, and the mother can decide what she wants or what she's comfortable eating. So as I said, few basic things she needs to take care of: the liquid intake and The fiber intake is good so that there is no urine infection and no constipation, because that leads to then other problems like hemorrhoids and all, which are again common postpartum. Other aspect of lactation is postpartum is lactation. Now that is an important aspect because the mother has to take care of the child, and feeding is altogether a new concept to a first time mother. Now usually the first time mother do struggle with lactation and feeding the baby. As I said, in first 2 to 3 days they are helped in the hospital by the lactation counselor, uh, who normally tell a lady or teach the mother the technique of breastfeeding, how to feed the baby, how to hold the baby, how to take care of their breast, how to take care of their nipples. All that is, they are given the information, and in the hospital they are helped how to feed the baby. Once it is initiated, the mother gains the confidence, and then the mother learns how to breastfeed the child. And of course there's some children also, they have to be initiated how to latch and how to feed. Usually, it is recommended that you feed the baby every 3 to 4 hours. So, basic guidelines and the basic technique is taught to the mother before discharge. And once she goes home, then again, she can use that knowledge. Plus, along with her elderlies in the household, they also help the mother in feeding. Of course, we prefer that the baby is on exclusive breastfeed, but at the same time, I would say we should let the mother and the child bond. Each that unit takes time. Some children and mother learn very fast, and within 2 3 days, they are quite expert in. Both of them understand each other. The child and the mother understand each other, and they are able to set the system of feeding and taking care very nicely. But some children are fussy, some children are difficult. They do create problems in latching, feeding, accepting breastfeeds. Now, all this does overwhelm the mother, and some mothers are distressed, they are stressed that they are not able to look after the child, and they go through that guilt complex that they cannot look after the child. The child may have this problem, child may have that problem. But as I said, with time, all the mothers do learn how to take care of their child, and they do form some method of communication. And each mother learns when their child is hungry, how much the child's appetite is. So gradually give yourself time. Don't be so stressed. And each child, as I said, is different, and each mother is also different. And individually, both of them learn how to feed or how to, and the child also learns how to fill their stomach. So as I said, basic of course is told to the mother, and the mother is informed accordingly. Again, danger signs when she has to report regarding her child, those are like child stop feeding, or if the mother feels that the child is quite, the palms and the feet are yellow, or the baby its breathing is very fast. So all these are warning signs, danger signs, or baby has fever, or baby has very excessive diarrhea. All these complaints, if they are there, then the mother should report to the hospital, and the neonatologist will take care of it. So these are in broad the basic care in postpartum care. Now, within 2 weeks, all this settles. So, usually, when the patient comes for a visit after 7 to 14 days, we look for all these things, that the patient's is feeding properly, the breasts are not engorged, uh, the baby is gaining weight nicely, the patient's wound, whether it is surgical, cesarean wound or an episiotomy wound, is healing nicely. So within 2 weeks, usually things have fallen in place. And then the last visit is usually a month later or 6 weeks post delivery. In that visit, mainly we talk to the patient regarding her going back to her normal lifestyle, working, regarding contraception, future, space, whether it is spacing of the children, the next child, or contraception, or other methods of sterilization, all these things, or vaccination, which suppose a mother is not rubella immune, then we prefer giving the rubella vaccine, or cervical vaccine postpartum can be offered to the lady. So the last visit and all this discussion is done. And if the patient has any other apprehensions or complaints, one can talk to, or she can talk to the doctor or go back to the health worker. So this is in broad, or this is just overview of postpartum care, which is generally given to all the patients. So I would like to see your questions and then answer those questions. I'll just go through these questions. So the first question is, how long do we bleed after normal delivery? Well, actually, fresh bleeding is more for about, say, a week or so. And then, yes, you do have bleeding roughly 4 to 6 weeks. But then by the end of 2 weeks or 3 weeks, it's mainly a blood mixed mucoid discharge, or what we call it as lochia. So that will continue for 4 to 6 weeks. The next question, is it normal to pass clots 2 weeks after giving birth? As I said, if you really have heavy bleeding and you're soaking too many pads in a couple of hours, it is an alarming thing. You should report to the hospital. Third question is, when can we start exercising on a regular basis? As I said, the patient should be ambulatory, walking, and simple household work. If the patient has had a normal delivery, some resume even after 2 weeks. They are able to do their basic, simple kitchen work. But if you're asking in terms of heavy, gym sort of exercises, then I would say in a normal delivery, 6 weeks. In cesarean, you can wait for about 8 weeks since your abdominal wound heals completely, and then you can start exercising. But simple exercises, you can start earlier. Regarding exercise, yes, I would like to mention post-delivery, before the patient is discharged, we do encourage the patient, if a patient has had a normal delivery and all, to do Kegels exercises, which is explained by our physiotherapist and team. Because internal muscles do become loose in normal delivery and they need to be strengthened. So these exercises help in strengthening the internal muscles. The next question is it normal to experience cramp after delivery? Yes, when you are lactating and you're feeding, it's nature's way of shrinking the uterus, or the feeding hormones does give a feeling as if you have cramps in your abdomen. So usually they settle, they are not troublesome, don't require any treatment. But in case the discomfort is too much and the mother is distressed by those cramps, then she can take an antispasmodic like a Drotin or a Meftal Spas to relieve. So these are the questions. Any further questions you can ask? So thank you. If there are no further questions.
Doctor, is it all? Can we end the session? Is that okay?
Yeah, we can end the session.
Thank you. Thank you so much. Thank you so much, Doctor.